Good afternoon, everyone, and welcome back to Systems and Sustainability Echo. My name is Shreya Prasanna, and I will be facilitating today's session. Some housekeeping before we get started. These sessions are enabled for live closed captioning. If you'd like to view closed captioning for this session, please navigate to the bottom of your Zoom window and select the Show Captions option. If you're having trouble accessing this, please chat Echo IT. We are recording these sessions for later distribution through the BeWell YouTube channel. Any info you put in the chat will not be shared on this recordings. As always, please stay muted unless you're speaking, and we do encourage you to speak. If you've joined by computer, your mute button is on the bottom left of your Zoom controls. If you're on the phone, just press *6. We encourage everyone to join by video for the discussion portion of our sessions. That said, regardless of how you've shown up today, we are just happy you're here to learn alongside us and share your perspectives in today's session. Because there are a lot of us here, we ask you to keep your comments brief to allow space for others to speak as well. You can use the chat feature to share comments and questions. Please note that no protected health information is allowed in either the chat or the discussions, and that includes sharing names, exact dates, relationships, or medical information in a way where somebody could identify that person. To help us with attendance, please enter your name, affiliation, and email into the chat function. We appreciate your support in helping us fully capture this record. To all the BeWell Texas providers, please make sure you identify yourselves during the session, or if you're joining via phone, please email your name and phone number to bewelltx@utisca.edu. Towards the end of the session, we will send out a link to an evaluation survey. Please fill it out to be entered into a drawing for a $30 Walmart gift card. Our didactic today is about data to dollars, principles of people-focused data management for financial sustainability, and will be presented by Shaun Jones. After that, we'll have some announcements and then hear a systems case from our learning community. As always, I encourage you all to share your questions, feedback, and guidance for the questions raised by our case presenter today. Remember, we're all teachers and all learners in this space. And with that, we will do some introductions. Kathy.
Hello, everyone. Welcome to the Echo today. I'm so excited about this topic. I'm Kathy Hudgens. I'm a consultant. I work primarily with program development and training for substance use disorder treatment and mental health integration into medical care. And I also do a lot of public policy work. So, hello.
Thank you so much for joining us. Bree.
Hi, good afternoon, everyone. Happy you were able to join us. And my name is Briseida, or B. Cotois, and I am the Director for Substance Use Treatment Care Services with BeWell Texas. Thank you.
Thank you so much for joining us. Matthew.
Yes, hi everybody. Good to be here with you. My name is Matt Rosa. My background's in clinical social work, agency administration, governmental planning. I work now full-time as a consultant in the areas of quality improvement, process improvement, and a lot of implementation coaching, supporting organizations and systems to implement a range of evidence-based practice. Thanks.
Thank you so much for joining us. Leslie.
Hi, everybody. I'm Leslie Manson. I'm a licensed clinical psychologist, and I'm an international subject matter expert on integrating substance use, mental health, behavioral health, and medical care treatments together. I provide consultation here in the U.S. and internationally, and I'm also an associate professor at Arizona State University. So thanks, everybody.
Thank you so much for joining us. Adrian?
Hi, everyone. Adrian Lindsay, Director of the Center for Substance Use Training and Telementoring here at BeWell Texas. Thanks for being here despite the schedule change with Thanksgiving. Nice to see everyone.
Thank you so much. Shaun Jones.
Hi, everyone. Shaun Jones with BeWell Texas. I'm a project manager here. I'm happy to present to you today something that's exciting and important and dear to my heart.
Thank you so much for joining us today. Dorothy West.
Hello, everyone. My name is Dorothy West with the Center for Recovery and Wellness Resources. I'm the Executive Director here. Glad to be with you all.
Thank you so much for joining us today. Andrea Hebler.
Hello, everyone. My name is Andrea Hebler, and I'm one of the program coordinators here at CSTAP. Happy to be here.
Thank you. And Jasmine Vidal.
Hello, everyone. My name is Jasmine Vidal. I'm a CSTAP program coordinator. Thank you for joining us today.
Thank you. And with that, we will move on to our didactics. Shaun, you can take it away whenever you're ready.
Okay, thank you everyone for joining us today. As I mentioned before, my name is Shaun Jones. I have a master's in public health, and I'm also a certified Scrum product owner, which is just a fancy way of saying that I'm trained in communicating client needs to the project team in order to create value in projects. I've been with Be Well Texas technically the longest, besides Dr. Potter. I was here at the start and had the benefit of learning through all of the different experiences we had scaling up our program from scratch. So I'm happy to share what we've learned with you. One of my theories in life is that we don't have to learn from trial and error. We can learn from other people's mistakes and other people doing that for us. Excuse me. Okay. Here's my disclosure. I have no relevant financial relationships to disclose. And of course, everything I say is my own opinion and doesn't reflect on the university or Be Well Texas. Our learning objectives today identify data management strategies in the context of grant writing, explain the significance of measuring and evaluating organizational activities to determine quantifiable and meaningful outcomes, and utilizing people-focused policies to do all of this work. So the 5 principles I'm going to talk about today, there are some overlap in them. There's transparency, repeatability, timeliness, relevance, and accuracy. I could think of probably a dozen more that we could talk about today, but we have just a limited amount of time. And a little bit of background about my road with data, my journey, is that I actually don't come from a data background. My background is in graphic design of all things. I worked as a website and print designer for over 10 years. So through that, I learned to communicate what people are asking for, or what they need, into something tangible, into a product or a user experience. I finished my master's of public health at UT School of Public Health in 2019 and began working in evaluations and data here at Be Well Texas. I'm very passionate about people doing their best work and change management. So that's what I bring with me as well as a project manager now. And believe it or not, I'm actually a technology minimalist. I'm very pragmatic in my approach to everything, including the data approaches that we have at Be Well Texas, using only what is necessary and not getting caught up in too much busy work. So we're going to talk about transparency, repeatability, timeliness, relevance, and accuracy. Each of these principles is designed to facilitate data management practices within your organization. We're going to talk about the desired states, system components, and the benefits that each of these principles bring. The end goal with any of this is that knowing our impact as providers, as organizations, and communicating that to our stakeholders, being funders or donors of any kind. If we can show that we're doing good work, that we're going to apply our money to the biggest impact, it's going to be beneficial in all of our grant writing and fundraising efforts. So to do this, I'm going to use an imaginary organization that I created as an amalgam of some lessons learned at Be Well, Texas, some of the organizations that I've worked with here, and also some other nonprofits that I've consulted with in the past as well. So all names have been changed to protect the innocent. Okay, start with our first principle, transparency. So this is probably one of the most important ones. This is why it's first, is that everybody needs to see our data. And that means our team, like the people at your organization need to know what they're doing. The clients need to know that they're choosing an impactful organization. And of course, our donors need to know. So the components that we're going to bring from this are public reporting. And that can be in terms of formal reports. You might publish an annual report on your website, but it could be informal. Using social media is a great way to get word out about your impact. And this is especially important for fundraising campaigns. But then we also have like larger outcomes or major programmatic outcomes. Those are things that are important for funders and grant writing. That being like major outcomes such as total numbers served, your budget numbers, things like that. And the benefits of this, cannot understate this enough, is that you get buy-in from your team, you get trust. And that's why the transparency is the most important, because if people can't see the impact that you're making, how are they supposed to trust you? So by creating this buy-in and trust, your team members can make data-informed decisions to improve outcomes. So you're talking about quality improvement here. And donors see their contributions are making an impact. So if somebody's on the fence about whether or not they should donate to your organization, this might show that you are doing the work that you're talking about. And clients, of course, we need trust with our clients to make sure that they need to make sure that they're working with an effective organization, somebody who is doing what they say they're doing. I have under system components a dashboard, and I'll show an example of this. Actually, I was going to save this for the end, but I'm going to go ahead and show it right now. And I'll share this out with anyone who asks for it. A simple data tool that I created for this presentation. Can everyone see the dashboard that says program overview? Get a thumbs up from somebody on our team.
Yes, we can see it.
Okay, great. So this is my imaginary organization, Imagine Recovery. This is their program overview dashboard for FY24. This is something that your staff would have access to. They know their major outcomes. They can talk these points out to stakeholders of various sizes, whether that is legislature, advocating for policy, or if your marketing team needs quick bullet points to push out in a social media post or in an article, this can provide that to them. And we're going to go through this page by page and step by step. This is not a very complicated dashboard. This is something I built in Excel. So I want to emphasize that data does not have to be complicated. Simplicity is definitely what we're looking for with all this, because it has to be easy to maintain. Shifting back, moving on to principle 2, repeatability. One of the biggest hurdles that a team can face is that calculating all these outcomes can be very time consuming. Producing reports can be very time consuming. And our desired state with repeatability is that your team members can create a report with minimal work. So if it's doing the work in the beginning to set up an Excel report, or if you have members of your team that use R or some other data analysis software, if they do the work in the beginning, we can produce these reports at a moment's notice, or if you have a dashboard, you can have that live most of the time. So our components for this are technology, and again, simple software, Excel or something along those lines is a very great tool. And one of the most widely used softwares in data science is actually Excel. It's a very powerful tool, so important not to underestimate its strength. Another component is tidy data, and what I mean by this is clearly organized data. That means your file folders are clearly organized, the structure of the data is clearly organized, and there are clear policies and procedures around how to manipulate that data. The benefits from implementing this principle are that everyone in your team uses the same methods to calculate numbers. This is very important because if we get into things like the difference between distinct clients and number of visits, that can be very different in how you add those up, because of with a unique number, you want to make sure you're not duplicating clients in your count. So you can't just add month to month. You have to do a deduplicated count by year if you want to add those up. Simple systems reduce time spent capturing data and analyzing data. And I don't know about all of you out there, but I know that our team can be pretty strapped for bandwidth when it comes to reporting periods, and being mindful that a lot of the organizations that we work with, a lot of our peers out there, are in similar situations where you don't have as many people as you want to get everything done. So we have people doing double duty. Setting up something simple in the beginning can help prevent dipping too far into your bandwidth like that. And most importantly, data can be reviewed frequently for decision making. Being able to look at your data at any time is a really great thing, so you can make decisions as issues come up. Timeliness. Before I move on to this one, I want to navigate back to our dashboard here, and I'm going to move on to the data entry page. This is all artificial data. This is not real data on real clients. These are all made up, used a computer program to make some fake data. But this is what I'm calling tidy data. So everything is clearly organized. This one sheet has all of your information for each client on a visit by visit basis, and we have a client ID to match them. Tidy data is really important because it is easier for machines to read. Everything is in one place. Everything is coded the same thing. There aren't 300 different reasons. There are only a handful of things, so everything can be categorized simply. That's what I mean by tidy data. There's a great article out there called the Tidy Data Manifesto. I highly recommend looking into that if you're sitting under a pile of Excel files right now. Okay, timeliness. So the goal with this principle is to have as little delay between services and data availability. And what that can look like is, again, having a system where data is collected, like that sheet I just showed you. That was our register of fake clients. That would feed into your reporting system or your data visualization system, your dashboard. And as soon as something is added into that, it automatically populates into the dashboard. The benefit of this being urgency. So I mean urgency in the very nicest way, that as soon as something happens, we know to respond to it. If there's a sudden dip in or a sudden increase in no-shows for a certain provider, you know that something is up and you need to course correct at that point. And also, with urgency, you have your most recent data as soon as a month previous to add into your grant application or to add into your presentation. It's always available, and again, without much effort to populate those numbers. Okay, principle number 4, relevance. This is where my background in Scrum project management comes in. The Scrum method starts with the user. Everything we build will start with the end user understanding what they need, how they understand the information, how they'll interact with it. So our desired state for relevance is data collection and reporting is directed to the intended audience and only pertinent information is tracked. So keeping it pragmatic, we're not deluging people with information, we're giving them the information they need specific to their needs. So our system components for this are one of my favorite things to do, which is actually a few of my favorite things to do. User sketches. Now, this is a technique where you create either in a brainstorming session or just on your own, basically an outline of who your end users are going to be. So for our organization, one of our end users is HHSC. So we would cater our reporting directly to just the information they are looking for. But another one of our users might be a policymaker. So we have different information that we provide to them. It might come from the same base of data, the same pool, but it's just different data points that they need for their work. And with that, my next favorite thing to do is making a logic model. How many of you are familiar with logic models? Drop that in the chat if you know what I'm talking about, or if not, I'm going to show you what I'm talking about here on our handy little data tool. This is a basic logic model that I put together for this fake organization called Imagine Recovery. And it takes your inputs, things that you have available to you, multiplies that by the work that you're going to do, and comes out with your desired outcomes. So we have our people. Those are the people doing the work, but also our clients, our donors. Those are all people that are in our system. Our resources, so that's things that we have available to use to multiply our efforts into creating good outcomes. So our experience, time, probably the biggest resource, funding, our website, our physical building, anything like that. From there, we go into the actual work we're going to do. So this organization is a peer recovery organization. So they have recovery coaching, case management, referrals to other services. Those are like the actual services they provide. But other activities are things like fundraising and advocating for public policy. This column called outputs, those are the measurables. So those are the data points that we're going to look for. That includes money raised, social metrics, clients served, visits, all of that sort of information. Those are the things that we're gonna put into our data model. That's what we're gonna collect. Doing a logic model like this helps you understand what data you need to collect if you're not already collecting it. And it helps you set up systems to collect that information. It's hard to collect data if you don't know what you're looking for. So by doing this in the beginning or as early as possible, you can help prevent that from happening. And then we have our outcomes. So these are what we hope to accomplish by doing our work as measured by our outputs. And that is, could be short-term, increased funding, increased web traffic, increased clients served, But if you can see here, we have increased clients served, decrease in missed appointments, increase of underserved groups, increased referrals to service. All those things lend to our medium-term outcome, which is increased treatment duration. So better, longer health outcomes. And that is our long-term impact from all of this, is improved sustained recovery for as many people as possible. And with our user sketches, we do end up having multiple levels of reporting. So understanding that what we would put on social media isn't going to be as granular as what we provide HHSC, for instance. So the benefits of this is usability. So one of the most important things we can do with all the work that we do is creating value. And by that, I mean something that is going to be useful and create benefit to the people we serve. And information is definitely one of those, because we will put a lot of work into capturing data and analyzing it. Not reporting just to report. That's one of the most important key things, is we're not just trying to push paper, we're trying to create meaning and show impact through our data. And finally, we're on to principle number 5, which is accuracy. Our desired state is that data are collected and stored in a way that effectively measures what is intended. Again, this probably bleeds into a lot of the other things we've talked about, but we can collect everybody's shoe size, but that's not going to help us provide really good treatment to them. We don't need to know that information, so we don't need to collect it. One of the most important system components for this are clear requirements from our external stakeholders. So when you are entering into a contract with the grant funder, they're going to have specific outcomes outlined in that they would like reporting on. Sometimes those outcomes aren't quite clear, so it's really important to get clarification on those items so that you can make sure you're collecting the right information to answer their questions. With that is the data dictionary. So that is our storehouse of what all these things mean when we talk about them. So what does number served mean in your organization? Is that just people provided medication? Is that people provided outreach? Making sure that is clear as early as possible. And again, making sure that all of our data collection tools are user focused. So what that means is making sure that our data entry is set up in a way that is going to reduce errors and is going to make it as less labor intensive as possible. So our benefits for this one are meaning and understanding. So if our data is accurate, if it is meeting the requirements of our stakeholders, if everybody is calling an orange an orange, it's going to be meaningful and understandable. Let's see. I think it's also important to point out that not all data is numbers. So I'll show my screen over here again. One of the things we collect at Be Well, and that a lot of our subcontractors also collect, are meaningful quotes. So this is the qualitative information. This is the color that fills in the black and white of our data. It tells us what they're experiencing from our services. So this does a lot. This not only has the important benefit of tugging at people's heartstrings, which I think is really important in this work that we do. I don't know about the rest of you, but we're not in this for the money, I don't think. I think we're a lot of really dedicated, crazy people who just want to give people the best opportunity for a good life that we can. And we want to emote that out to people through our communications. So capturing what our clients are saying about us and good experiences is really important. And even in my dashboard here, I have a quote of the day from that field is, so that automatically populates there. So if you are a coach at Imagine Recovery and you log in and you look at this in the morning, you have a reminder of why you're there, what your impact's going to be. So I like to have that little bit of daily inspiration. Okay. So you might not believe me, but the easiest part of data management is the technology. We've already gone through that sample on one data tool, but I think it's really important to emphasize that with whatever platform you use, that's the easy part. Like if you go with something like an EHR or an electronic recovery record system, those usually come with pretty good support and change management built in. Even if you go with something like this, building something in Excel, this is relatively, I say relatively easy. It might not be super simple, but it's something that can be done with the help of a consultant or with some really good YouTube tutorials. There's a lot of great information out there. Additionally, and this might be controversial, but I would like to say that using generative AI to help you calculate things, and by that I mean creating formulas, not actually looking at your data. One thing you can do with generative AI is basically ask your chatbot, in Excel, how would I calculate X, Y, or Z? And it'll actually write the formulas for you. So I'm definitely an advocate for using AI in that aspect. But of course, we're talking about very secure information here. So you do not want to put this data set into a chatbot, for instance. Additionally, in this sample tool, I've got my data dictionary and the logic model that we looked at, as well as the quotes. Having the data dictionary right here is a great tool because if I'm a coach at Imagine Recovery and I'm not sure what outreach means, I can go here and figure that out. If I'm not sure if they're a healthcare worker, that's all there as well. So using Excel as a simple solution for that is great. And I am happy to share this with anyone who emails me and asks for it. So please do. And I almost forgot to give credit to a member of our data team who helped, who actually developed this template, and I adapted it with the dashboard. But it's always a team effort here. So we're happy to share all the lessons we've learned with building these tools. Always make sure it's secure. So we are, depending on your organization, you should make sure that your vendor for your data storage or your platform is TextRamp certified. That's a new certification that the state has for cloud-based data storage. It has to follow those guidelines. Has to be 42 CFR Part 2 compliance. That is a higher than HIPAA level of security for substance use data. Most importantly, version control is important too. If you are using Excel files, make sure everyone is using the same Excel file, just so you don't end up entering data into two different files and not knowing why they're not adding up to the same number. Last but not least, the hard part, change management. This is the hardest part about any data or technology implementation. It's also my favorite thing to do at my job is getting people excited about useful technology tools and new processes. I like this model, the ADKAR model, starting with awareness. You develop that within your team, their desire to participate, knowledge on how to change. It's really important that people know what they need to be doing. Ability, so the instruction, the tutorials they might need to learn the platform, reinforcement, so always being sure to remind people to keep at it while the change is happening. It takes a decision from leadership to start the change, but it definitely takes a clinician, someone in the support staff to be a vanguard for change. It always has to be coming from all sides. I think it's also important to realize that the quickest way to implement change is to be patient with it, which is kind of counterintuitive. You can't rush or force change on something as big as the data or technology implementation. It does take time, and you kind of have to let it happen at the course that it's happening within your group. You can't force it. You just have to continually advocate for it and elicit people's buy-in. I think that about wraps it up. Jasmine, I will stop sharing and hand that off to you. I'm also, I can share this presentation. I have all my resources that I use to prepare this presentation, some great resources for what data you should be looking at, what you can measure, and some information on change management.
Thank you so much, Shaun. That was an excellent presentation. And in the interest of time, I think maybe we have time for maybe 1 or 2 questions at the most, because we do have to move on to the case. All right. Thank you so much, Shaun. And we will keep looking out for questions in the chat. In the meanwhile, Karen, if you can please bring up the announcements for me, please. Thank you. The Center for Substance Use Training and Telementoring provides high-quality education and best practices for responding to substance use. CSTAT can help enhance professional knowledge and self-efficacy to screen, treat, and make referrals for people with substance use disorders. To learn more, please visit us at cstat.yudhiska.edu. Next slide. Do you have a difficult case that you or your team have encountered? CSTAT offers you the opportunity to present any challenge your organization is encountering and receive feedback from our expert hub and broader learning community. You don't need to prepare a formal presentation. We will provide you a case form to fill out to assist with your case presentation. Please email us at cstat@yudhiska.edu. Next slide. To claim your CME credits, you must text this code by midnight tonight. Please text attend 1009520 to the number on the screen. We will be dropping this information in the chat as well. Next slide. A quick reminder, there is no Systems and Sustainability Echo session in December due to the holidays. However, you can join our harm reduction, public safety, and TextRx Echo sessions. The next session for the Systems Echo will be in January on Jan 25th. Next slide. Join BeWell Texas for a virtual information session to learn more about the services offered. You can scan the QR code. We will also drop the registration information in the chat. Next slide. Texas 2024 is officially open for exhibitors and sponsors. The Texas Symposium will be taking place in Austin on Feb 29th and March 1st. For more information, please visit our website at texas.org. And with that, we will move on to our case for today. Dorothy works with an organization that provides recovery support services inclusive of RSPS training, recovery housing and transportation, intensive and supportive outpatient services, and office-based opioid treatment, MAT services for individuals with substance use and mental health disorders. Dorothy, please tell us a bit about your role in your organization and what are some of the barriers that you're currently facing?
Thank you. Yes, my name is Dorothy West. I'm a person in long-term recovery. And what that means is I get an opportunity to sit and learn and grow with those that are working in addiction recovery. So we've been in business since 2010. We opened an RCO in Houston, and be mindful that we were licensed chemical dependency counselors with lived experience that had no business background into RCO that really no one knew about RCOs at that time. So we kind of were like grassroots, totally figuring this thing out as we go. So we were building the plane as we flew it, serving our community. And as time went on, we learned as we grew to manage SAMHSA grants and state grants. And so we just kind of learned the hard way in how to sustain. We are members of Faces and Voices of Recovery. So therefore they had a recovery data platform that we got involved in to help us kind of pull all our work together. So thank you, Shaun. I've learned a lot, and I hopefully I can reach out to you to get some further help there. But our challenge now is that, you know, we have lost my husband, Dylan West, who's the founder of the Recovery Community Organization, Center for Recovery and Wellness Resources, last year. And me being the program director have, you know, moved into that position. I've pretty much been up and down the highways and byways learning about recovery support all over the country with Dylan. So therefore, I definitely know that it's quite a challenge to keep the doors open when you don't know a lot about business. And so that's what I'm getting a rush job in financial management, board leadership, governance, and all the things that an executive director should know. So that's kind of a perfect, you know, to be on this echo with Shaun, because these are the things we did not do at the beginning. You know, we had a lot of data and we did not know anything about, you know, pulling it together to be of value, to get donors, to, you know, our longevity came from word of mouth and trust from the community. So we were just strictly built by love. And particularly, you know, being a person in recovery, we definitely knew the population. So we knew the needs, even though we did a community needs assessment. We were the ones that we would want to know the shoe size. So we would need to know how to go about getting those items for the people that we serve. Because again, there was like not a lot of connections to donors. And even now, that's one of our challenges as I learn, is to how to build discretionary funds to be able to help sustain us, you know, through learning through Baylor College of Medicine, actually, a little bit about grant writing. So we couldn't really afford to continue to pay for grant writers. So I had to learn some of that as well. And, you know, we were awarded a couple of grants through SAMHSA as well as HHSC, which, you know, actually helped us to learn how to, you know, grow and respond to performance measures and things. So we have, we really, you know, thank people being open to new service deliveries like recovery support services. But like I said, where our challenge now is to kind of continue to grow. Our contracts have been reduced where we used to work directly with HHS. We're very blessed to work with Be Well Texas. You guys definitely help us kind of pull a lot of systems together. But it is also a loss of revenue. So without having the direction on how to pull in money, when we lose revenue, it's lost, it's gone. And it's like, and then of course, our head, Mr. West, who really had a lot of his information in his head, I really didn't know what all that he did because of conflict interest being married. We kind of kept real good boundaries there. But yet with his passing, like I said, I'm in a crash course of learning. And I'm excited about it. Like I said, we have great mentors and people around us that have been very compassionate with our RCO. But sustainability, I tell you, I really did not look at the years that passed, but 13 years and being, on the front lines of the change from treatment to our recovery-oriented system of care. It had been quite a challenge to usher in recovery support services to a very resistant clinical environment. And I was glad to get to see these challenges, because now, it can be a great working relationship through clinical services to recovery support services. And as we've seen across the nation, as people were recognizing the wonderful combination that was, a lot of RCOs in other states were bringing on clinical pieces to their RCO just to survive. As you know, just recently, money has just been put into RSS services. So everything we did, we had to really do janitorial contracts to help put our peers to work, to pull those contracts in. We've done, we've been running recovery housing for a while. When I say for a while, since 2011. And it's always been a mat house. And I know that there's a lot of information on proficiency of mat houses. But, I believe us building according to the National Association of Recovery Residents, we've been held safe and been able to meet the need of the community by providing what the community needed. So, of course, when you're in the trenches, that's what you hear, the need, the cry. And we hope that as we continue to work with our population, which is predominantly underserved, uninsured, community, that is affected with substance use and mental health conditions, and being a place that really is a drop-in center to, send them to other organizations that can help meet their needs. So we don't have to do it all. We have so many partners and collaborations that it's really a blessing to not contribute sustainability just on what we knew, but what everyone else was also gravitating to, which was recovery support services. And we were all learning how to help each other here in Houston. And our mentors
And Dorothy, I'm going to stop you there just to make
Okay.
sure that for the sake of time,
Okay.
can you share with the group exactly, sounds like you all are trying to refocus also your scope of practice and services to get the most out of because you've connected to partners.
Yes.
Can you tell the group so they can sort of help you, what service lines or services are you hoping to grow that you would need funding for? Because of course, when you're doing that grant searching and you're looking for funders and partners, focusing on what areas you need growth in or you're having the most trouble funding would be really helpful for the group.
Okay, thank you. Well, our main focus is recovery support services, because that encompasses so much, from our coaching staff all the way down to providing what the community needs. So recovery supports, we are growing our OBOT as well as our inpatient and outpatient treatment. Yet we don't have any contracts there. So therefore, that's kind of like a slow kind of beating drum right there. But we will always be a recovery community organization, and we'll always need support there providing for the underserved. And so far, like I said, it's been good, but yet it's pretty rough. When we lose revenue, then obviously it's hard to substitute that.
So does the group have any ideas or thoughts for Dorothy about the revenue, sources, or the grants that or funding sources that might support the services that she just outlined? Because it sounds like that's where you want to grow, especially those contracts for your OBOT.
Mhm.
And I think that question you're asking, Kathy, dovetails with the chat we were having before our meeting started related to opportunities for partnership, particularly for smaller organizations who are disadvantaged when it comes to accessing different kinds of funding streams, because you do have limited staffing resources to be able to write grants and explore opportunities, and where might partnerships exist. And I'm curious if anybody has any thoughts about that as well.
And even if it's the, parts of grants that you may be looking at now that could pull in an organization like Dorothy's as a partner to fulfill whatever those grant requirements are, because a lot of times you may have something, and a certain, like an organization like Dorothy's may have something that actually could work together well.
Well, and I just want to add, I am an example of the population we serve. My lived experience, like I said, I've been incarcerated, I've been in an addiction, I've been in having to rehabilitate my life and to go back to school and to raise a kid and to do all these things. That's who I'm working with. And I think that's who you all are working with. And I believe that, even sometimes I sit on panels as an expert. I'm not an expert. I'm just a person that is willing to do the work to get what our community needs. So if you have any more questions, for me, you want to dive a little deeper outside of this, then I put my information in the chat. But yeah, we do a lot of collaboration, actually, because again, together we're stronger.
Dorothy, I think you might get an argument from some of us as to whether or not you should be called an expert. I think you're going to get one from me. I'll speak for myself.
I was wondering if the community or has any suggestions in how to support the grant writing efforts that Dorothy was speaking about.
Yeah, that's a great question. Sure. I was wondering if anyone's had experience in working at big systems and working in small systems. And how do you get these grants done? How do you find ways to do it? What do you have any wisdom or strategies as you think about different system sizes and resources that you have to do that work?
So I think that Beef had she was looking earlier at a couple resources that are in the state. And then I put in the chat foundationcenter.org. And Dorothy, you're probably very familiar with that resource. It's a grant writing and grant search engine. But in order to get the grants written, Bee found a resource center in Texas. Bee, do you have that link? Do you want to put into the chat?
I think B is not here.
We will make sure
Yeah.
that you get that link, Dorothy, because there's a center in Austin, I believe, that she found that actually will help you write those grants. And I feel like, and then also provide some coaching on that. It sounds like you've done a whole lot of your own work with that, but you can't do that and keep the whole plane running too. So, you know, getting that support and then looking at someone else in your organization as someone who can support your grant writing, which you probably have, but you know, spreading the wealth there, but getting your staff involved, because you really want to help them learn how to also manage their grants once they get them, and helping to write them and to develop them is a really good opportunity to also build capacity within your staff who really want to learn from you.
And that's exactly how we do it. Really, we'll take a little piece, and it's really neat because, you know, by being a trainer for recovery support specialists since the inception of it here in Houston, we've trained over 2,000 coaches. You know, we put them out there, and now they're running organizations and all over. So our sustainability with staffing came from people volunteering, which it was first an altruistic type of movement when there was no money associated with recovery support staff. So building leadership within our community is exactly how we operate, from a person receiving services to now a person being on staff and, you know, moving up the ranks and participating in different projects like the grant writing. So using what we got and finding the strength in others that enjoy doing behavioral health work, and finding out what their strengths are.
I know oftentimes with smaller organizations, there's a hesitancy to think about outsourcing things because the first question is, outsource with what? That costs money.
Yeah.
But are there, and I think we have had a little bit of a chat as a group about resources that may be available where you have minimal costs or minimal upfront costs to be able to connect with others collaboratively, or to outsource some of the tasks that may be hard to do because you and your team have certain areas of critical expertise. And how do we keep you focused on the things that you're good at and that you really do well, and then maybe outsource or partner for some of those things that you don't have experience in and that are really a drain on your team because of that, because it's not in their kind of wheelhouse in terms of focus and mission and work experience.
Yeah. And all of it's easier said than done, because obviously being in business for 13 years without really having a business background has been a trial and error. And yeah, you can learn from other people's mistakes, but we have managed to stay alive, and we have managed to continue to grow. And I don't think we're going anywhere. I don't think the good Lord has that in the stars for us. So I would love to concentrate mainly on providing services. Like I said, I did get with a business developer to take us to the next level, to help us deal with discretionary funds or stuff like that, that we can, you know, outsource grant writing in different areas. But spending $5,000-$10,000 on a grant writer and you don't get the grant, you know, that we've done that, and that definitely empowered us to try to look in how do we sustain by learning to do these things ourselves. And then we end up finding the wonderful gifts that the community has, you know, in regards to their expertise in understanding the nature of the problem of substance use in their neighborhoods. And I'm really thinking that that's a strength for our organization versus having to outsource it, but still allow that participatory process to continue to grow as they work alongside someone that really knows what they're doing.
I think in the interest of time, I will request Kathy to please summarize some of the recommendations for today.
So Shaun gave us a wonderful presentation on data and reporting, the use of data, making sure that you use timely, consistent, simple data that is clear and transparent to external and internal stakeholders, to report your outcomes, to show the relevance of that data, to attract your funders, and also for program development and for quality improvement, and then making sure that your data is accurate, clear, and also secure, and you back it up. We also learned a little bit about Dorothy's organization and talked a little bit about how we might want to strengthen organizations through grant writing and partnership.
Thank you so much. And thank you all again for joining today's ECHO. Thank you, Shaun and Dorothy, for presenting today and sharing your insights and experiences. Once again, a quick reminder, we do not have an ECHO session in December. Our next ECHO session will be on Thursday, January 25th. As a reminder, to earn CME credits, please complete the post-session survey using the link in the chat. And also, please text attend 100952120 to the number on the chat as well if you need CME credits. If you'd like to present a case, please email bveltx@ithaca.edu. Thank you so much and have a wonderful holiday season. Bye-bye.
Thank you.
Thank you.
All right. Happy holidays.
Happy holidays.